In this video, I will be discussing about the lungs, which are a major organ of the respiratory system. The lungs oxygenate blood to be carried around human body. This is done by inhaling the air and bringing it in towards the pulmonary capillaries, which then carry oxygenated red blood cells that help with respiration. As you can make out, there are two lungs, a right lung and left lung in the body, but they differ in sizes. The right lung is bigger while the left lung is smaller, as it has to make room for the heart. The lungs are divided into lobes by grooves coursing across its surfaces known as fissures, as you will see later on. The right and left lung do not have an identical lobular structure. The right lung is divided into 3 lobes and the left lung consists of 2 lobes. Now I am going to tell some introductory information concerning the bronchopulmonary segmental anatomy. The division of the lobes of lungs into segment is based on the tertiary or segmental bronchi. So what are these tertiary or segmental bronchi? To start with, the trachea divides at the carina, forming the left and right main stem bronchi, which enter the lung substance to divide further. This initial division is into secondary or lower bronchi. Subsequent divisions of the secondary or lower bronchi give rise to tertiary or segmental bronchi. Thus, a bronchopulmonary segment is defined as that area of the lung which is supplied by the principal branch of lower bronchus, that is, tertiary or segmental bronchi. The segments are separated from each other by layers of connective tissue that forms them into discrete anatomical and functional units. This separation means that a bronchopulmonary segment can be surgically removed without affecting the functions of the other segments. Each segment has its own pulmonary arterial branch. However, the venous and lymphatic vessels pass through the intervening septa that separate the segments from each other. There are no superficial anatomical markings that facilitate identification of the bronchopulmonary segments, aside from the pulmonary fissures. So they cannot be seen from outside of the lung. That identification process requires identifying and tracing the tertiary bronchi to their distal ramifications. They may be appreciated on X-rays or bronchoscopy. Talking about the segments of the right and left lung, there is some form of segmental symmetry between them, even though the left lung is smaller and only contains 2 lobes. In general, each lung has 10 segments. The upper lobes contain 3 segments. The middle lobe or Lingula contains 2 segments and the lower lobes have 5 segments in all. With this basic symmetric anatomy shared between the lungs, there are a few differences that I will be describing as I go through the video. Now I will be discussing about the segmental anatomy of left lung in detail. Although, like right lung, the left lung also has 10 segments, but since there are cases in which they are ventilated by the same bronchus, some of the 2 segments are counted as 1. Consequently, there are fewer bronchopulmonary segments on the left side than on the right. On the left lung, as you are seeing, there is only an oblique fissure. As such, the left lung is only divided into superior and inferior lobes. Now you can appreciate the hilum of the left lung. The hilum or the lung root is a collection of structures that suspends the lungs from the mediastinum. Each hilum contains a bronchus, pulmonary artery, 2 pulmonary veins, bronchial vessels, pulmonary plexus of nerves and lymphatic vessels. All these structures enter or leave the lung via the hilum. Here you are able to see the structures of the hilum which I have mentioned before. Now you can see the superior and inferior lobes of the lung separately. Focusing on the lower lobe of left lung, you can see 4 segments, namely anteromedial, superior, posterior basal and lateral basal. But if you remember, I had mentioned earlier in introduction that lower lobes of both the lungs has 5 segments. The explanation for this disparity for the left lung is that there are 2 regions of the left lung in which 2 segments are joined as one, as they have a common tertiary segmental bronchus. These segments being the apico posterior segment of the upper lobe and anteromedial segment of the lower lobe. Coming to the upper lobe of left lung, which you can see now, the upper or superior lobe of the left lung contains 4 bronchopulmonary segments. The apico posterior segment, the anterior segment, the superior lingual and the inferior lingual segments. Coming to the apical posterior segment, the apico posterior segment can be labeled as S1 and S2. Although they could be considered as 2 segments, the reality is that they are seen as only one to be ventilated by the same bronchus. The apico posterior segment represents the fusion of apical and posterior segment. It is limited posterior-inferiorly by the superior aspect of the left oblique fissure and is adjacent to the anterior segment, that is S3 of the superior lobe. Talking about the lingula of the left lung, which can also be called the lingular lobe, although it is incorporated in the upper lobe of the left lung, the reason being it replaces its counterpart, the middle lobe of the right lung. But in contrast to its equivalent of the middle lobe of the right lung, the lingular lobe of left lung has 2 segments divided into superior, that is S4, and inferior, that is S5 segments, whereas the middle lobe on the right has 2 segments, medial and lateral. The superior lingular segment is located between the caudal boundary of the anterior segment and the superior border of the inferior lingular segment. Both are anterior to the hilum of the left lung, and the inferior segment is limited inferiorly by the inferior half of the oblique fissure. The segments of the lungs can be remembered by a mnemonic phrase Asia Alps, ASIA ALPS, where A stands for apico-posterior, S stands for superior lingular, I for inferior lingular, A for anterior, A for anteromedial basal, L for lateral basal, P for posterior basal, and lastly S for superior basal. Now I will talk about the segments of the right lung. The right lung has 2 fissures. the horizontal and oblique fissure. As seen here, the horizontal fissure runs horizontally from the sternum at the level of the fourth rib to meet the oblique fissure. The oblique fissure can be seen running from the inferior border of the lung in a superior-posterior direction until it meets the posterior lung border. Consequently, there are three lobes on the right, that is, superior, middle and inferior lobes. Now you can see the three lobes are being separated away in the video. Focusing on the superior lobe, you can appreciate that it has three bronchopulmonary segments: the superior apical, the superior anterior, and the superior posterior segments. The apical segment or S1 segment is V-shaped and constitutes the apex of the lung that extends to the second rib. Below and posterior to the apical segment is the posterior segment, that is S2. It is shaped like a quadrilateral directed towards the back and whose chest wall surface is related to the second, third and fourth ribs. When viewed from the costal surface, this segment is limited inferiorly by the posterior superior part of the right oblique fissure and posterior part of the horizontal fissure. As the name suggests, the superior anterior segment, that is S3, is anterior to the posterior segment and antero-inferior to the apical segment. This can be appreciated nicely in this video. It is limited inferiorly by the horizontal fissure. It is located parallel to the bronchi of the middle lobe from the hilum to the periphery. It has almost a quadrilateral shape. Now coming to the inferior lobe of the right lung. The inferior lobe of the right lung has 5 bronchopulmonary segments: the superior segment, the posterior basal, the lateral basal, the medial and the anterior segments. Now you can see the superior segment, that is S6, which is represented on both the costal and mediastinal surface of the right lung. This segment originates on the posterior aspect of the main bronchus, has a triangular shape with the vertebra T4 to T8 at its base. The medial basal segment, that is S7, is best represented on the mediastinal surface of the lung, as it lies below the hilum. It is located below the pulmonary hilum and is one of those that appears to the diaphragmatic face as all segments from 6 to 10. It is also called cardiac segment, an important part of the mediastinal surface. It is anteriorly related to the posterior basal segment, that is S10, which abuts the lateral basal segment, S9, around the posterior border of the lung. Coming to the anterior basal segment, that is segment 8, this is the segment located in the ventral section of the oblique fissure of the lung and is juxtaposed with the lateral basal segment posteriorly. The lateral basal segment is S9. This segment also has the shape of a triangle whose apex points to the hilum and whose base occupies the costophrenic angle. The basal posterior or S10 segment has a triangular shape. In this case, the vertex points to the hilum. Now you are able to see the hilum of the right lung with the structures as mentioned previously, that is the bronchus, the pulmonary artery and pulmonary veins. Coming now to the middle lobe of the right lung, which lies between the horizontal fissure superiorly and the antero-inferior part of the oblique fissure inferiorly. It is subdivided into lateral, that is S4, and medial, that is S5, bronchopulmonary segments. The lateral segment is best represented on the costal surface of the lung. It is located in the middle lobe of the lung and is seen on the costal side. With its triangular form, it forms a sort of wedge between the horizontal and oblique fissures. The medial segment is best seen in the mediastinal phase, from which it occupies the entire surface of the middle lobe of the lung, just in the middle part of the horizontal fissure with which it fuses and is close to the heart. The superficial boundary of the medial segment wraps around the anterior border of the lung. It tapers off at the hilum and is superiorly related to the oblique fissure. Now coming to the way in which one can remember all this segment is by using the mnemonic phrase, a palm seed makes another little palm, where A stands for apical, P for posterior, A for anterior, L for lateral, M for medial, S for superior, M for medial basal, A for anterior basal, L for lateral basal, and P for posterior basal segment. Now I would like to add something about the clinical importance of bronchopulmonary segments. The pulmonary segments serve to guide thoracic surgeons in the precise interpretation of radiographs and other medical images of the lungs. Knowledge of these segments is also essential for surgical resection of diseased segments. Usually the infection of the bronchopulmonary segment remains restricted to it, often localized in the posterior segment of right upper lobe and apical segment of the right lower lobe. The infections of the bronchopulmonary segment may be surgically resected since they are localized to one bronchopulmonary segment, whereas tuberculosis and bronchogenic carcinoma may spread from one segment to another. During treatment of lung cancer, the surgeon may remove the whole of the lung, that is called pneumonectomy, or he can remove a lobe, that is called lobectomy, or a segment of the lung can be removed, that is called segmentectomy. Patients who are found to have relatively small lung tumors may be candidates for removal of only the affected portion of the lung. This procedure, known as segmentectomy and wedge resection, is dependent on the number of segments involved and the status of the contralateral lung. The segmentectomy refers specifically to the removal of an anatomical segment of the lung, while the wedge resection is the removal of a non-anatomical portion of lung parenchyma. The opposite lung should be able to compensate for the decreased lung volume. So viewers, with this I have come to the end of description of the lung segments. Hope this video would have added to your knowledge about the anatomy of the lung segments. Please share this video, like and subscribe to my channel so that I am encouraged to post further such videos. Thank you.